welcome back everyone to the Dizzy Talk. And today I'm gonna tell you about main signs of early autism and जिसके बारे में हम बात करेंगे. Why am I making this video is because today, personally speaking, I've experienced जब से मेरी posting changes हुई हैं, then I've come to know about a lot of things. I've come to know that autistic children आजकल बहुत ज़्यादा हो रहे हैं, and even mild ones are also showing some kind of signs which we feel that they should be cured at early stages. Otherwise उनका जो development है and the growth that is hampered to some kind of level. So that is why we need to know कि क्या क्या early signs है of autism which can be a sign so that you need a specific therapy for your child. So this video can also be for the parents themselves कि अगर उन्हें लगता है थोड़ा बहुत भी, because parents are concerned and sometimes over concerned as well for their children, so we can easily distinguish if it is autism or if it's not. So starting with the most important part is autism is just not autism, it is the autism spectrum disorder, that is also called as ASD, and that is why spectrum means a group of symptoms which underlie causing it a main disease. Sorry for the throat. Well, actually I'm posted in my speech internship, so that is why मेरा थोड़ा सा गला ऐसा हो रखा है, but it's okay, mind it. And yeah, the first sign it can be lack of eye contact. Children usually don't make eye contact. Doesn't mean कि मतलब वो सिर्फ एक eye contact ऐसे ही नहीं देख रहे हैं, but most of the time and throughout their day they don't make eye contact with you while talking, while conversating, or while expressing anything of themselves. So that is the first point. Second can be, I'll be quick with all the points so that you don't get bored or something. Yeah, so second point can be lack of paying much attention towards one thing. For example, if I'm doing something or if I'm reading something, I am not taking my attention off of it, and afterwards I'll just do something else. What happens with autistic children is they just pay attention towards one thing at a single time, and then they just take their attention towards the another side, and with just a millisecond or something, they don't pay attention towards one such thing, they just pay attention towards many things at a single time, and that is why we can say that there is a lack of attention. Third sign can be they blabber or they just vocalize sometimes. जैसे हम बोल सकते हैं कि स्पीच और लैंग्वेज तो ऑलरेडी डिले होता ही उनका, बट व्हाट हैपन्स इज देयर vocalizing, they just keep doing few things which they think that is mandatory to do. For example, they'll keep doing like this, they just keep moving to and fro, or if they just make sounds such as like something like that, just to keep them busy and to keep them busy with their own thoughts. And that is why we call autism as a neurodevelopmental disorder. They think of themselves, they don't think what is going on, they think beyond that, and beyond that they have so many thoughts at one time. So yeah, that can be a third sign. Also, fourth can be they have sensory issues. Well, sensory issues can be something like moving their hands like that, or something like they just keep eating, or they just eat some kind of shirt को खाना शुरू कर देते हैं, and many more sensory issues. They just like whenever एक autistic बच्चे को occupational therapy, you might be knowing about the OT, अगर आपको नहीं पता है तो we can talk about it later in the later videos. लेकिन whenever a child is given an autistic therapy, occupational therapy, उनको जब भी they are getting solved with the sensory issues, they like it very much, right? So that's what happens in an occupational therapies to reduce the sensory issues that they are facing with, and teeth clenching also be one of that. So yeah, dealing with them. Also, these children might be a little bit hyperactive at times, which is why I would say hyperactive means they don't sit quietly for a longer period of time, because they don't have sitting. As I already told you, attention isn't just with eyes, it's also with the sitting as well. So what happens is they don't sit and they just keep reacting to things hyperactively rather than just sitting or just taking what's said to them. So that is how they react to normal activity with a hyperactive nature, and that is also solved with the occupational therapy and also For the speech concerns, जिसको भी speech concerns हैं, because obviously वो autistic children are delayed in speech and they don't express, they don't communicate, so that is why उनको speech therapy की भी ज़रूरत होती है, and that is why we give them speech therapy, and then we let them know that we are talking to them or something, that they should know that there is a connection in between the talker and them. So that is how so many goals are made. So these all can be called as an early signs of autism. And yeah, one more point I remember, thoda sa late yaad aaya, but toe walking or something, if they do, if they it's just like, you know, keh sakte hain ki 1 or 2 times it's fine, but if they do it frequently in a number of days, or they repeat it sometimes, that can be an early sign in future. So you need to take a bit of conscious care about your children, and if you think that they do have autism, do get themselves checked and assessed properly with a nice speech therapist or someone that have this knowledge. And so we'll come up with more videos, and especially for the parents. And speech therapy में autism में बच्चों को therapy देते कैसे हैं? Actually, you might have seen so many videos like ऐसे करना चाहिए, but no one actually tells you how to give a speech therapy. So that is why I'm here, and I'll come up with another video. Till then, do subscribe my channel, and here I am, your Dizzy Doc. Bye.